So you go home expecting to feel normal again, but then something doesn't match. You're weaker than you thought you'd be. Walking across the room feels like effort. Stairs feel harder to climb. You get tired faster than you expected. And a lot of people have the same thought at that moment. Why do I feel worse than I thought I would? I'm Arne Facklam, nurse practitioner and fellow of hospital medicine, and this is Beyond the Stethoscope. And today, we're talking about something almost nobody explains clearly. What actually happens to your body during a hospital stay, and why rehab matters more than you think. Because here's the part most people don't realize. Hospitalization doesn't just treat illness, it changes your body. Even a relatively short hospital stay can lead to something called deconditioning. That's a clinical word for what patients describe very simply. I feel weaker. And it happens faster than most people expect. When you're in the hospital, you're not moving the way you normally do. You're in bed more. You're sitting more. You're walking less. You're eating differently. You're sleeping poorly. And on top of that, your body is dealing with whatever brought you into the hospital in the first place. Infection, inflammation, surgery, pain, medications. All of that adds up. And what we see clinically is this. Muscle strength starts to decline within days. Endurance drops. Balance can change. And in older adults especially, that change can be significant. So when patients say, I feel like I aged 10 years during that hospital stay, they're not imagining it. Now here's where the disconnect happens. From the hospital's perspective, you're ready for discharge when you're medically stable, meaning the immediate threat to your life or health has improved. From the patient's perspective, ready for discharge often means, I should be back to normal. And those two things are not the same, not even close. That gap between medical stability and functional recovery, that's where rehab comes in. And this is where a lot of people misunderstand what rehab actually is. Rehab is not just about exercises, it's about function. When healthcare teams are deciding what you need after the hospital, they're asking very specific questions. Can you get out of bed safely? Can you walk without falling? Can you make it to the bathroom in time? Can you climb the stairs in your home? Can you take your medications correctly? Can you do the basic things you need to do to live independently? Because here's the truth most patients never hear directly. The hospital's job is to stabilize you. Rehab's job is to get you your life back. And those are two very different goals. Now let's break down what rehab actually looks like, because it's not just one thing. There are different types, and each one has a very specific role. Physical therapy focuses on strength, mobility, and balance, getting you moving again, helping you walk safely, reducing your risk of falling. Occupational therapy focuses on daily life, getting dressed, bathing, using the bathroom, cooking, managing your environment safely. Speech therapy is not just about speech. It can involve swallowing, especially after illness or surgery. It can involve cognition, memory, attention, problem solving. And depending on what you've been through, you might need one of these, or all three. Now here's another part people don't expect. Rehab doesn't always happen in one place. Sometimes it starts in the hospital. You'll see therapists come into your room, getting you up, helping you walk, assessing how you move. Sometimes you go to a rehab facility for a short period of time before going home. Sometimes it happens at home, with therapists coming to you. And sometimes it's outpatient, after you've already been discharged. But regardless of where it happens, the goal is the same. Close that gap between being medically stable and actually being able to live your life again. Now here's where this becomes really important. Because from a patient perspective, it's very easy to think this. I'm home now. I just need to rest. And rest does matter, but too much rest, especially after a hospital stay, can actually slow recovery, or even reverse it. From a clinical perspective, what we worry about is this. If you don't rebuild strength and function early, you may not fully get it back. And that's one of the biggest drivers of something patients never see coming. Readmission. Ending up back in the hospital. Not because the original illness came back, but because the body never fully recovered from the first hit. Weakness leads to falls. Falls lead to injuries. Fatigue leads to decreased activity. Decreased activity leads to more weakness. And suddenly, you're back in the system again. And this is why when a provider strongly recommends rehab, it's not a suggestion we're making casually. It's a risk decision. We're thinking about what happens next, not just what happened already. Now let's talk about the emotional side of this, because this is where patients and families struggle the most. You go into the hospital expecting treatment. You don't expect to come out feeling like you have to rebuild yourself. And that can be frustrating, sometimes even discouraging. You think, why am I not bouncing back faster? Why does this feel so hard? And the answer is, because recovery is not just about fixing the problem that brought you in. It's about recovering from everything your body went through while you were there. And that takes time. And it takes effort. And in many cases, it takes structured rehab. Now, quick pause for just a second. If this is the kind of thing you wish someone had explained before your last hospital stay, do me a favor and hit follow wherever you're listening. And if you're watching on YouTube, like and subscribe. It takes 2 seconds, and it helps more people find this kind of real-world explanation. And one more thing. If you or someone you care about is going through a hospital stay right now, I created something specifically for this. It's called the Plain Speak Health Hospital Survival Toolkit, and it walks you through what to expect, what's normal, what's not, and what questions to ask. There is also a Plain Speak medication guide that helps you understand what you're being prescribed and why, in plain English. You can find both at ps-health.com, because your recovery shouldn't feel like guesswork. All right, back to what we were talking about. So here's the bottom line. If you or someone you care about is leaving the hospital, and rehab is part of the plan, that's not a sign that something went wrong. It's a sign that the team is thinking ahead, trying to make sure you don't just survive the hospital stay, but actually recover from it. Because being discharged is not the finish line. It's the starting point of recovery. And if you've ever gone through this, or watched someone you care about go through it, and thought, why didn't anyone explain this better? You're not alone. Follow Beyond the Stethoscope, because the healthcare system makes a lot more sense once someone finally explains the why.